Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic is how is polio virus confirmed? Ordinarily, it is taken for granted that polio is a thing of vaccination. But how do you know if you have poliomyelitis apart from when it has really been established with these elongated limbs and difficulty breathing and all the associated symptoms? The primary area of confirmation is the medical laboratory, and that's why the medical laboratory scientists play the major role. The clinical examination could just pinpoint a presumptive confirmation, that is, it is a likelihood of whether you have this flu-like problem. It could be flu, it may not be, but the confirmatory aspect has to come from the laboratory performance or by medical laboratory scientists confirming that yes, this is polio virus that is really ravaging that patient. Having said that little much, the whole confirmation process and the knowledge you need to know about poliovirus, I shall expose it in the slide section. And like I've always said, if you like my presentation, if you like my video, press the like button, especially subscribe, because your subscription goes a long way to show appreciation. The objective: to show the role of the medical laboratory scientists in the eradication of poliomyelitis and also in demystifying poliomyelitis. The introduction: poliomyelitis is caused by poliovirus from the Akinola-Anjou family, as you can see in this picture. It is a single-stranded RNA virus with no envelope, making it very difficult to kill with chemical surveillance. The least severe form of poliomyelitis that shows the mildest symptom is called abortive poliomyelitis. That more or less will not cause that crippling. The non-parametric poliomyelitis are more severe than abortive, while the paralytic poliomyelitis is the most severe and may result in permanent paralysis and death if it affects the breathing muscles. Poliomyelitis has no cure, and so it is something that one must really appreciate the effort of the WHO at eradicating, which has been very fruitful so far. Poliomyelitis is a crippling disease caused by three serotypes of the wild polio virus, namely type 1, 2, 3, and also copy 1, P2, and P3, which results from the three different capsid proteins covering the viral genome that elicit immunological response from the immune system. Vaccines are produced against these three serotypes. The vaccine, from that shape that you are seeing, the area covering the capsomia forming the capsid protein is what really distinguishes the three types. The protein causes that reaction. And wild polio type 2 was eradicated with vaccine in 1999, while wild polio virus type 3 was eradicated in 2020. Endemic wild polio virus type 1 still remains in Afghanistan and Pakistan, and very few. So when we say endemic, it means it is permanent, more or less, as being still there, general. But it could be present in some other states that are just scanty and are not assumed that endemic stage level. Yeah, let's talk about how we encounter poliovirus. While poliovirus is mainly a human virus, it does not really inhabitate other animals or whatever, that is transmitted through the fecal oral routes. It goes through the surfaces of the nasopharynx, as seen in that picture, And because it is acid resistant, like many enteric viruses, as also can see in this classification, is an enterovirus, it is easily reached. It can easily reach the intestine, where it's now more or less established itself. If it's the abortus type, it does not go beyond that. But the Weiler type, the more invasive type, that is the paralytic poliomyelitis, usually ascribed to as the type 1, would go beyond and enter the bloodstream. It is when it invades the bloodstream, it can also invade the CNS, that is the central nervous system, as can be seen in that picture. The brain itself, the brain stem cell, the brain stem cell stem, it could invade that area and multiply, causing damages and then releasing itself. It is that destruction that really affects, because it will not allow the messages sent to the muscle to contract or whatever to really happen. So once these neuron cells are destroyed, then the problem becomes very obvious. If it's going to affect the breathing muscles, it will surely result in death. So the way it infects human cells by binding to an immunoglobulin-like receptor, CD155, also known as the poliovirus receptor, on the cell surface of leukocyte. Interaction of the poliovirus and CD facilitates an irreversible conformative change of the viral particle necessary. Now let's look at the case study as if we are looking at the symptoms. Young boys 12 to 17 reported flu-like symptoms, fever, up to 39 degrees centigrade, sore throat and muscle pains, and all the flu-like things you see, even some resembling malaria. This lasted 1 to 3 days. 2 to 3 days after, they complained of stiff neck, yes, getting closer to paralytic problems, increased muscle pain, and fever up to 41 degrees centigrade. This was followed by flaccid paralysis of the leg. So we are now talking all of clinical examinations that is done by the medical doctor in his office or in the consulting room or in the wards. But the laboratory diagnosis, this diagnosis was confirmed by the isolation of type 1 virus from the feces and throat swashing of patients with paralytic disease. We must know that in infants, you don't find this often because the virus is not as neurotrophic, that is moving into the neurotrophic, into the nervous system, and is more likely to confine its replication to the alimentary canal, that is in the intestine. That's where it's more or less caused. Now, laboratory diagnosis. This is the area very important if we really want to confirm what is affecting any patient that presents with flu-like symptoms or sickness. The samples usually collected as 2 rectal swab, throat swab. Hardly do you get it in CSF, but at least you will see some derangement in the CSF. The microscopy, using the electron microscope, you could even detect it in the stool because it has that particular shape that is shown there. Also by immune electron microscopy, where you are trying to stain some of these immune bodies, that is the antibody-antigen reactions. Virus isolation, the virus that you really want to isolate using medium tissue cultures. You will find the samples as feces and throat swab cultivated in monkey kidney tissue culture, human amnion, HeLa cells, F2, buffalo green, monkey, NRC, and other cell cultures. Cytopathic or cytopathogenic effects appear within 3 to 6 days. Serology and molecular diagnosis could also be done. Finally, the conclusion. The 3Y polio virus knowledge of eliciting immunological response from the host was what informed the production of vaccine. Without that knowledge, that is identifying the three components, the three protein that really cause this body to produce this antibody, it will not have been possible to really produce antibody in readiness to attack the virus, because antibodies will surely attack and neutralize the virus as it comes in. So it is that antibody that is very useful in production of vaccine, and that they reside more in the intestine, awaiting the virus to come, and there they multiply, they proliferate. So the vaccine produced against the three types, which drastically decreased white polio virus cases by over 99% since 1988, from an estimated 350,000 cases in more than 125 endemic countries to 6 reported cases in 2021. The oral polio virus vaccine could also be a problem in immunized areas, as the vaccine virus is also excreted, and that could pose a danger in areas of inadequate sanitation. It can genetically change into a form that can paralyze, that is what is known as a circulating vaccine-derived polio virus, CVD. The circulating VDPCs is treated like outbreaks by immunizing every child several times with the oral vaccine to stop polio transmission, regardless of the origin of the virus. We must acknowledge the laboratory role very well. The laboratory role in confirming the eradication of any of the P1, P2, and P3 cannot be overemphasized, because it's very necessary that we acquire this knowledge and appreciate what these particular professionals are doing. You can always watch many of my videos. It is on this same channel as Akinola-Anjou. You'll never get tired on health matters. It's good to acquire knowledge and also use it to be wise and wealthy.